exactly is hospice and palliative care, and why should it be important to you? Hello and thanks for joining us. I'm Laurel Hess and this is Comcast Newsmakers. Joining me now is the Associate Medical Director for Great Lakes Caring, Dr. Scott Paxton. Thank you so much for joining us today.
Good afternoon.
We've certainly all heard the word hospice, and most of us believe we know what it is and what hospice does. Palliative care, perhaps not so much. What's the difference?
Palliative care is a service that is being provided to patients in the community, both in their home and also in assisted living environments and nursing home environments, with the goal of supporting patients that have chronic and progressive conditions, but are maybe not emotionally or spiritually or medically ready for hospice.
And when do you become ready for hospice?
You become ready for hospice when your doctor certifies that you have, in his or her estimation, 6 months or less to live. At that point, you can choose or not choose to work with a hospice organization, and those services are provided under the direction of Medicare and comprise a nurse, a social worker, an aide, and a chaplain that support your medical, spiritual, and physical needs.
At what point should an individual or family be reaching out and realizing that perhaps they could benefit from either palliative or hospice care?
They should ask questions of their doctor. One of the biggest problems that we have is that communication with their primary care physician or the specialist that they're seeing is really not thorough enough for a variety of reasons. Sometimes patients are afraid to ask the question. Sometimes the physician maybe is challenged for time. And so one of the things that I try to do is encourage patients and families to talk to their doctor about where they're at in their disease process. And sometimes I, as an advocate for them, will ask those questions of their specialist or doctor. So when I work with patients, we do a lot of communication with other professionals that are involved in their care.
And you work alongside someone's primary care physician or their specialist, sort of providing additional care and serving other needs?
Absolutely, yes.
And how important is that social worker or that aid aspect? Because that's not really curing or helping to make their pain go away.
Well, the social worker aspect is for those patients that get into the home environment, and there are many times there are needs that haven't been fulfilled as far as durable medical goods, needed services like oxygen. Sometimes they have financial or advanced planning challenges. They have no estate planning. They have no advanced directives. They haven't talked with anyone about some of the needs that are missing in their home, and patients spend obviously the bulk of their time at home. So when we work with patients in their home, we identify a lot of problems that maybe we're not aware to the doctors that are caring for them when they go to the hospital.
And as far as your organization goes, Great Lakes Caring, there are many hospice organizations out there, correct, that call themselves hospice of this or are you all affiliated? Do you all practice under the same umbrella of this is our philosophy of care?
The hospice philosophy has a consistent thread throughout all the organizations. Our organization is an independent entity, but we work in concert with several different divisions. Our home care provides care to patients in 3 states, Ohio, Indiana, and Michigan. And they work in concert with the palliative program as well as the hospice program. And the goal is to help patients transition from one stage to the next with a minimum of rehospitalization or adverse events or other challenges that result in them ending up back at the hospital.
All right. Thank you so much for joining us today.
My pleasure.
Today's Comcast Newsmaker was Dr. Scott Paxton, the Associate Medical Director for Great Lakes Caring.